Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is, what is the best treatment for spinal stenosis? Well, first of all, what is spinal stenosis? It represents a narrowing of the spinal canal with pinching of nerve roots, usually due to bony and soft tissue overgrowth from arthritis. It typically occurs in patients over the age of 50, and it's often seen at multiple levels and not symmetric. Here's a cartoon that shows the disc here. This is the spinal canal, and you can see that it's almost an ellipse, okay, nice and open. But when you have spinal stenosis, you get this bony and soft tissue overgrowth from the areas around the spinal canal, maybe a disc coming back, facet joint overgrowth, and it starts to pinch. So symptoms are going to vary between patients. Typically you have an aching pain in the buttock region and that leg on the affected side, or maybe bilateral if it's both parts of the spinal canal being affected. May have symptoms of sciatica. In unusual cases, a person can have leg weakness. You don't really usually see that. And it may be mistaken for a hip joint problem because the pain can radiate around into the groin. Usually the symptoms are position related. Leaning forward feels better because what it does is it frees up the nerve roots in the spinal canal. So if you look in a textbook on spinal stenosis, you'll often see a picture of a shopping cart because patients will feel better as they lean forward on a shopping cart. And they'll say, I feel better when I go shopping. And that's why, because they're leaning forward, it's opening up the nerve roots because the spinal canal gets larger. Now, when you look at neurogenic claudication versus vascular claudication, neurogenic claudication is what you see with spinal stenosis. Patients usually have pain that starts in the buttock and the hip area and goes down a little bit. Patients with vascular claudication, such as peripheral vascular disease, they usually have pain that starts in the calf area and goes up. And it's usually time related, like, I walk for 50 yards and it really starts to kill me, as opposed to neurogenic claudication where it's position related as opposed to time. In reality, most people with spinal stenosis have actually no symptoms at all. There are various treatment options, including over-the-counter anti-inflammatories and Tylenol. Studies have shown that Neurontin and Lyrica, which are neurogenic stabilizing medications, have exceptional results for pain relief. Physical therapy can help. Spinal decompression therapy is a computerized intermittent traction that has excellent outcomes. And then epidural steroid injections have been the gold standard for decades for spinal stenosis. Here you see one option, which is a caudal epidural steroid. Here's the lumbar spine and the sacrum. There's an opening here called the sacral hiatus, and that's where the pain doctor will inject a larger amount of steroid and numbing medicine, which migrates up and can provide pain relief with multiple levels of spinal stenosis. Whether or not to have surgery for spinal stenosis is truly a quality of life decision that should only be made after considerable conservative treatments fail. Over 95% of patients can avoid surgery with spinal stenosis. The typical surgery is a lumbar laminectomy. This is where some bone and soft tissue is removed to free up the nerve roots that are being pinched. Here is a picture of what a surgery might look like. Here you have the spinous processes, which are the bumps in the back of the spine. And if you have bilateral symptoms, the surgeon will remove the lamina on the right and the left and free up these nerve roots as they're getting out from the spine. It's a low-risk procedure. It's about an hour long, but it is surgery, and half of patients end up with stiffness post-operatively, and there is a chance that scar tissue can form around one or multiple nerve roots and cause post-laminectomy syndrome and pain. The bottom line with spinal stenosis is that surgery can be avoided over 90% of the time. Epidural injections can be repeated every few months. Whether or not to have surgery is a quality of life decision, and when you add a spinal fusion to it, it adds a whole level of complexity to the procedure. The TEX-PAIN Network offers the top pain management in the Dallas-Fort Worth Metroplex area. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.